of Cigna Europe. He has held this position since January 2020. Thank you for joining us today. Arjan, we're meeting today to talk about universal health coverage and mental health. I thought it'd be helpful to just briefly contextualize what you do. You're responsible for the overall management, growth and profitability of Cigna's operations across Europe and the UK. And I wanted to hear a little bit today about mental health in a workplace context, because we're certainly hearing more and more about this as an important part of public health and healthcare generally. But I'm curious what you can share with us about how big this issue is in workplaces.
Sure. And first of all, thank you for having me, and thank you for being part of this really important conversation. A lot of really important health-related topics have been covered earlier today, but we haven't really spent a lot of time talking about mental health. And at the risk of maybe sounding overly dramatic, I do think we're actually faced with another global pandemic, which is a mental health pandemic. It's a huge issue, and it's an ever-increasing issue, unfortunately. So WHO recently indicated that on an annual basis, we're losing about 12 billion working days in productivity because of anxiety and depression. And that represents about $1 trillion in actual loss of productivity. So it's a huge issue. But of course, behind those big sort of macro numbers sits a lot of pain, a lot of emotion, a lot of individual issues that people are faced with that I think as a society, but also from an employer perspective, we need to make sure we address.
And are those numbers getting worse, do you think? What's the trend line?
They are. Cigna recently did another survey amongst workers around the world that indicated that 88% of all workers are suffering from symptoms of burnout. 88%, that's a really scary number, and it's never been that high. So we definitely see that go up year over year.
What are the causes of that, do you think?
Well, I think not all of it is workplace related. Let's be clear on that. We are going to be talking about the role that employers need to play here, but it's not all workplace related. At the same time, we do know and understand that things like the feeling of needing to be always on, needing to be always connected, the blurred lines between personal life and work life, which of course, because of COVID and the fact that everybody's been working from home, has been amplified. It's not a new issue, but COVID has definitely made it worse. I mean, those are some of the things that are definitely playing a role here, but we also see in our research people are increasingly worried about the future. They're increasingly concerned about financial situation, which of course in a high inflationary environment, it's not really helping.
Right.
So it's all these concerns sort of, contributing to that overall increase in mental health related issues that we see.
So pandemics, inflation, cost of living, these are problems that employers alone can't fix.
That's right.
What can employers do to alleviate this suffering?
Yeah, and again, I do think employers have an important role to play. First and foremost, because that loss of productivity has a real impact on employers' ability to deliver on their overall objectives. Secondly, because we all spend a lot of time in the workplace, so it is important that a lot of these issues get addressed in the workplace as well. But then thirdly, and I think this is really important, something has fundamentally changed in the way employees are expecting their employer to step up and deliver comprehensive health and well-being support. So again, Cigna does a lot of research in that respect, and the most recent study that we did indicated that 40% of all employees expect their employer to play an active role in helping and supporting their overall health, but also their mental health. At the same time, the reality is only 24% of employers are actually offering that. So there's a significant gap there. And that's a risk to employers because we're also in a war on talent. There's a shortage of skilled staff in many parts of the world, in many industries. And if employers want to be able to win that war on talent and want to be able to attract and retain the best people, they're going to have to step up and they're going to have to do more. Now, you asked me the question, what can employers do? So I think it's a couple of really important things. First and foremost, help remove the stigma around mental health, because that is still a really important issue. And by setting the tone from the top, by talking about mental health in the workplace and acknowledging that it is an issue, I think that already makes a huge difference. Help people in terms of the access to mental health care. That's another really important thing. We work with a lot of employers who are putting in place comprehensive mental health programs. including digital mental health support, cognitive behavioral therapy programs, on-site medical screenings. So all of these things help to make it easier for people to get the help and to get the support that they need. So those are two very tangible things that I think employers can do.
Arjan, thank you so much. We're out of time, but I've learned a lot in this brief period with you. Thank you.
My pleasure. Thank you for having me.
Thanks. Okay, now I would like to introduce a panel on funding mental health and wellness. And on this panel, we have 4 panelist members. The first is Nathaniel Counts, who is the Senior Policy Advisor for Mental Health to the Commission